Cortisol is often referred to as the stress hormone, but its role in our bodies is much more complex than that simple nickname suggests. Produced by your adrenal glands, cortisol helps regulate your metabolism, controls blood sugar, reduces inflammation, and assists with memory formulation. But when your body produces too much cortisol for too long, it can throw your entire system out of balance, leading to a variety of symptoms that are visible, noticeable, and potentially harmful if left unchecked. Let's explore 12 signs of high cortisol you can actually see. Clear clues your body is sending that it may be time to take action. First, notice changes in your weight, especially around your midsection. One of the most common signs of high cortisol is unexplained weight gain, particularly in the abdominal area. You might notice that even if your eating habits haven't changed, you're accumulating fat around your belly, while your arms and legs might actually look thinner than before. This is because cortisol alters the way your body stores fat, encouraging it to accumulate centrally. If your waistline is expanding without a clear reason, high cortisol could be a factor. Second, pay attention to your skin. High cortisol levels can cause your skin to thin, making it more fragile. You might find that you bruise easily, even from light bumps or scrapes. You may also notice slow healing wounds or frequent purple or red stretch marks, particularly on the abdomen, thighs, or upper arms. These stretch marks, known as striae, are wider and more pronounced than typical stretch marks and are a classic physical sign of elevated cortisol. Third, look for acne or other skin breakouts. Cortisol stimulates the sebaceous glands in your skin, increasing oil production. This can lead to more frequent or severe acne breakouts, even if you didn't struggle with acne in your younger years. Persistent or sudden acne, especially when combined with other symptoms, may be a sign your cortisol levels are too high. Fourth, observe your face for puffiness and changes in shape. High cortisol can cause your face to appear rounder and fuller, a phenomenon sometimes referred to as moon face. You might also see increased puffiness around the eyes or cheeks, giving your face a swollen appearance. This is often due to fluid retention and changes in fat distribution, both of which are influenced by cortisol. Fifth, watch for signs in your hair. Excess cortisol can disrupt the normal growth cycle of your hair, leading to thinning or noticeable hair loss. You might find more hair than usual in your brush or shower drain, or you may notice thinning in specific areas, such as along your hairline or part. For some, high cortisol can also cause unwanted hair growth in places where it's not typically seen, like the face or jawline. Sixth, observe your muscles. Chronically high cortisol can lead to muscle weakness and wasting. You might notice that your muscles seem less defined, or you feel weaker even if you haven't changed your activity level. For some, this can be seen as a loss of muscle mass in the arms and legs, making the limbs look thinner in comparison to the trunk of the body. Seventh, examine your skin for increased pigmentation or darkening. Some people with elevated cortisol develop patches of darker skin, particularly in skin folds such as the elbows, knees, armpits, or neck. This condition, called acanthosis nigricans, is a visible sign that hormonal imbalances, including high cortisol, may be affecting your body. Eighth, notice if you have more frequent or severe infections. Cortisol is a potent anti-inflammatory, and when levels are high for a long time, your immune system becomes suppressed. This makes you more susceptible to infections like colds, flu, or even skin infections. You might see more frequent redness, swelling, or sores that take longer to heal. If you find yourself battling one illness after another, it could be linked to high cortisol. Ninth, pay attention to your eyes. High cortisol can increase blood pressure, which may lead to visible changes in the blood vessels of the eyes. Some people notice red or bloodshot eyes, or even swelling and puffiness around the eyelids. In rare cases, vision problems can develop, so it's important to take note of any changes in your eye's appearance or function. G. Sininat. Observe your sleep patterns. While you can't see sleep problems in the traditional sense, the visible signs of poor sleep, such as dark circles under the eyes, a tired or drawn appearance, or even yawning and drooping eyelids, can be indicators of high cortisol. Cortisol is meant to be highest in the morning and drop at night, but chronic stress can disrupt this rhythm, leading to insomnia or restless sleep. 11th, notice changes in your mood or mental state. High cortisol affects the brain, and while emotions aren't visible, their impact can be seen in your posture, facial expressions, and even your interactions with others. You might notice increased irritability, anxiety, or even signs of depression, such as reduced interest in activities or social withdrawal. Chronic stress and high cortisol can make it harder to handle everyday challenges, and the effects often show up in your demeanor and behavior. 12th, check for high blood pressure. While you can't see your blood pressure without a monitor, some physical signs can suggest it's elevated. Persistent redness in the face, headaches, nosebleeds, and a flushed appearance can all be subtle hints. Since cortisol helps regulate blood pressure, chronically high levels can push it higher than normal, presenting these visible symptoms. Now that you've learned about these 12 signs, it's important to understand that having one or even a few of these symptoms doesn't necessarily mean you have high cortisol. Many of these signs can be caused by other conditions or factors, such as medication, other hormonal imbalances, or lifestyle habits. However, if you notice several of these changes, especially if they develop suddenly or worsen over time, it may be worth discussing your symptoms with a healthcare professional. What causes high cortisol in the first place? Chronic stress is the most common culprit. When your body perceives a threat, whether it's a looming deadline, financial strain, or even lack of sleep, your adrenal glands release cortisol to help you cope. While this response is helpful in the short term, ongoing stress keeps your cortisol levels elevated. Other causes include certain medications, particularly corticosteroids prescribed for inflammation or autoimmune conditions, as well as rare conditions like Cushing's syndrome, which occurs when your body produces too much cortisol due to a tumor or other medical issue. So, what can you do if you suspect your cortisol is high? First, focus on stress management. Techniques such as mindfulness, meditation, regular exercise, and deep breathing can help lower cortisol naturally. Make sure you're getting enough sleep, ideally 7 to 9 hours per night, and practice good sleep hygiene. Eating a balanced diet, rich in fruits, vegetables, whole grains, and lean proteins, can also help regulate your hormones. Limiting caffeine, alcohol, and processed foods can make a significant difference. It's also important to address any underlying medical conditions with your doctor. Blood tests and saliva tests can measure your cortisol levels and help pinpoint the cause of your symptoms. If a medication is responsible for your high cortisol, your doctor may be able to adjust your dosage or suggest alternatives. Remember, your body is always giving you clues about what's going on inside. By staying alert to visible signs like changes in your weight, skin, hair, and mood, you can catch problems early and take steps to restore balance. Managing stress, leading a healthy lifestyle, and seeking medical advice when needed are the best ways to keep your cortisol and your overall health in check. If you're experiencing several of these signs of high cortisol, don't ignore them. Small changes in your daily routine can have a big impact on your stress levels and hormone balance. Prioritize self-care. Seek support when you need it. And remember that taking care of your body today lays the foundation for a healthier tomorrow.